Imagine a world where the simple act of sipping your morning coffee or taking a leisurely stroll in the park becomes a daily struggle. A world where uncontrollable tremors and slow, stiff movements dictate the pace of your life. This world is a reality for millions of people living with Parkinson's disease. But today, we're here to introduce you to a remarkable treatment that's changing lives, bringing back hope, and offering a way to regain control. It's called deep brain stimulation. First off, what exactly is deep brain stimulation, or DBS? Well, DBS is a medical procedure that involves surgically implanting a small device and thin metal wires called electrodes into the brain. These wires then send electrical pulses to specific parts of the brain, helping to regulate abnormal brain activity and control motor symptoms, which are symptoms that involve movement. Think of it like a pacemaker for the brain, designed to improve various conditions such as Parkinson's disease. Now, before we go into more detail about DBS, let's briefly explain what Parkinson's disease is. Parkinson's disease is a health condition that affects the brain and, as a result, the way a person's body moves. It happens because clumps of proteins, called Lewy bodies, build up in the brain and stop some parts of the brain from working like it should. Imagine your brain is like a control center for your body's movements, and in people with Parkinson's, this control center gets a bit mixed up. Some of the most common symptoms for Parkinson's disease are tremors that cause shaky hands, legs, or other body parts, moving slowly or feeling like you can't move as quickly as you want, stiffness causing your muscles to become tight and not as flexible as they should be, and sometimes people with Parkinson's disease have balance troubles and have difficulty staying steady or might fall more easily. They may also have difficulty writing and speaking. Their handwriting may become small and hard to read, and speaking might become softer or harder to understand. The exact cause for Parkinson's disease isn't entirely clear, and that's why doctors around the world have not been able to find a cure. Instead, treatments like DBS aim to help improve some of the symptoms that people living with Parkinson's disease face. Now let's get back to DBS. The surgical procedure for DBS involves several steps. First, the patient is carefully evaluated to determine the exact target areas in the brain. Then, a brain surgeon implants thin electrodes into these areas. These electrodes are connected to a small battery-operated device placed underneath the skin, typically near the chest area. In DBS, we carefully choose specific spots in the brain to place electrodes. These spots have fancy names, but let's simplify it. Think of the Parkinson's control room as a part of the brain called the subthalamic nucleus. In Parkinson's disease, the signals for movement in this control room become all jumbled up, like a bunch of tangled wires. These cause the symptoms like tremors, stiffness, and slow movements that we talked about before. Now, with DBS, we place tiny electrodes right in this control room. These electrodes are like expert electricians. When they're turned on, they help unscramble those mixed up signals. It's a bit like untangling those wires to make everything run smoothly. And what's the result? Well, when the signals are clear and organized, movements become much smoother. So DBS can help decrease the symptoms associated with Parkinson's, allowing people to move more freely and comfortably. It's like giving the Parkinson's control room a helpful hand to make things work better. So what are the benefits of DBS? Well, we have talked about some already, but DBS serves as a powerful ally in the battle against specific motor symptoms. Remember that scenario we talked about before, where sipping your morning coffee or taking a stroll in the park becomes a daily struggle? Well, with DBS, those movements become smoother, and stiffness and tremors are significantly reduced, making those activities, as well as other activities, such as writing and eating, possible. DBS can be transformative for some people, helping them regain motor control and their independence. Moreover, it often allows individuals to reduce their reliance on medications, if not stopping them completely. However, like any medical procedure, DBS has its limitations. It doesn't cure Parkinson's disease or other conditions, but rather manages the symptoms. It typically works best to lessen symptoms of stiffness, slowness, or tremors, but does not work as well for imbalance or non-movement related symptoms of Parkinson's disease. Additionally, there are risks associated with surgery and potential side effects, such as infection or mood changes. Not everyone is able to get the procedure either. Only people who have had Parkinson's disease for at least 4 years and whose symptoms are not being controlled by other medications are allowed to get the procedure. Also, DBS may worsen thinking or memory problems, so it is not recommended for people with dementia. As we look to the future, ongoing research aims to refine DBS techniques and expand its accessibility. Researchers are working to improve upon existing DBS devices and methods to help treat more symptoms and more people. Some researchers are putting electrodes in a different area of the brain, the pedunculopontine nucleus, to treat walking and balance problems that don't typically improve with present-day DBS. Others are developing a smart DBS device that can record a person's unique brain signals and deliver electrical stimulation only when needed, such as when symptoms return rather than continuously, as the current systems do. This would help reduce side effects such as numbness and weakness and lengthen the battery life, which would result in a longer time between battery replacement procedures. Scientists are also planning to test deep brain stimulation in the first years after Parkinson's diagnosis to see if the therapy may slow or stop disease progression. Testing in a Parkinson's model showed that therapy may help protect brain cells, and a small human trial showed motor symptoms improved after early-stage DBS. In conclusion, deep brain stimulation is a remarkable medical advancement with the potential to transform the lives of individuals with Parkinson's disease. While it's not a cure, it offers hope and an improved quality of life to millions of individuals around the world. Thank you for joining us on this journey to explore deep brain stimulation. We hope you found this video informative and helpful. If you have any questions or would like to learn more, please feel free to reach out to your healthcare provider. And remember to always consult with healthcare professionals to determine the best treatment options for your unique situation. Thanks for listening.